Hi there, how are you today? Well, on this video, I would like to talk about patient-doctor relationship. I've been too reluctant to to address this topic in the sense that I believe everyone is different and everyone has their own beliefs and way of practice. As they say, there are different ways to arrive to a certain destination. I don't know, different ways of killing a rat. Let's not talk about killing rats here, anyways. Yeah, you can take a different transportation and arrive to the same destination. Can go by air, go by road, can use a train, but still you will arrive to the same destination. So I believe we are all different, and each one of us has their own way of practice, except that we are all binded by the same oath, and our focus should actually be the same. I've had people asking me to address this issue, but for those reasons, I have been quite reluctant. Today, I decided to address this issue, but mainly basing myself or as an example, or based on my own experience and my own beliefs. So this should not be generalized to other medics or other doctors. Well, for me, I believe most of us, let me not even say for me, most of us, once the patients arrive in our offices or in our clinics, we take that very seriously. For me, a patient, left their home to us, meaning that, whatever they were going through has become unbearable. As we know, Dr. Google is very much alive, and at the same time, we have Dr. Neighbor, Dr. Relative who are at home. When someone is going through something, then you'll find that Dr. Neighbor or Dr. Relative or Dr. Google would already have prescribed a certain remedy or told them what they're suffering and all that. They would have tried or a number of stuff before coming to us. So by the time they come to us, usually I take that very seriously in the sense that, huyu sasa ashashindwa. Anyways, I like any other doctor, I take the normal procedures, history taking, examination, investigation if need be, then management. But not all patients require a prescription. Not all patients present in our offices having a certain, symptoms of a certain diagnosis. There has been some instances whereby patient presented with symptoms pointing out to a certain diagnosis, but after a thorough review, examination, investigation, then it concluded that neither of the differential diagnoses were right, or so to say, like they didn't have any, like they didn't, there was no diagnosis that could be placed to whatever they were going through. Well, thinking outside the box, humans being humans, we are all humans and all that, you'll find that maybe that headache was not even related to hypertension, diabetes, or any other thing, but probably maybe due to something personal that a patient could have been going through, maybe some stress and all that. For what I'm trying to say is that, as medics, as doctors, we should literally sometime go beyond our normal practice and at least, lend an ear to these patients, because sometimes, like patients most of the times cannot differentiate between a symptom that is related to a certain disease or a symptom that is related to a certain condition that they are going through. So to say, they cannot point out that this headache is for hypertension or this headache is for stress. So when we've exhausted all our ways of doing things, and we've not derived to a diagnosis, then it's usually good to allocate at least some few minutes, to inquire about this other line. Like this other type of life, this other, yes. So literally, What I'm trying to say is that, we should not limit ourselves to a common doctor practice of how are you, presenting symptoms, taking history, examination, investigation, and then treatment. We should literally go beyond our way as doctors and be human as well, in the sense that, sometimes these patients, all they need is just someone to lend an ear to, and they probably need someone who is not familiar to them, a stranger, so to say, yeah. Unfortunately for us, our systems are not so straight, in the sense that, when someone is going through some stress or depression and all that, they could find their way to a psychologist, to go and get attended to, explain themselves and all that. Even if probably we have some few hospitals or offices or clinics with that service, unfortunately not all the patients can afford. Not all patients can afford to have such services. So by the time patient lands in our offices, whether it is for a certain diagnosis or not, at least we should attend to them, allocate some few minutes, hear them out. I totally understand that, there are probably other patients outside waiting and all that, but how good is a patient leaving your office unsatisfied or unmanaged, or so to say, less satisfied, or with the same problems that they came with, initially. How good is that, or how pleasing is that to us as medics, to us as doctors? Patients value us, they view us so highly, and they believe that most of the time, if not 80%, that we will be able to tell them what they are going through, and we will be able to help them, so to say, heal them. So what I'm trying to say, I mean, like, I thought I should address these issues, in the sense that I've had complaints from patients and from different patients, complaining that there's some doctors or some medics whereby they're unapproachable. Like a patient feels unease, because most of the time they are more focused on uh, the patient is here, managing the patient quickly and letting the patient go, without even taking their time to even ask, some basic things or something like that. So on that capacity, I thought I should address this. Let's not treat patients, as as patients, but patients as human beings. Not all patients require a prescription. If we dedicate our time to them, then we'll be able to save them from harmful behaviors. We'll be able, to at least attain satisfaction. I've had cases whereby a patient had tried to commit suicide. I've had cases whereby patients were actually thinking of committing suicide and all that. Suicidal cases are very high, and if we don't contribute effort, or we don't join hands to help patients, then we'll have more deaths than saving lives. One thing though, patients don't come to us, pointing out that, oh, I had I was trying to commit suicide and all that. They would come with presenting symptoms, or they will come with requests. If you find that, a case, for instance, a patient presents to you underage, or maybe 20 years or below or above, and they are requesting for generalized checkup, like, I need to know the function of all my organs and all that, and you are wondering, why is this, like, she's so young or he's so young, why would such a patient be worried about? It's another thing if maybe they've been asked to present a medical report, but if just voluntarily someone comes to ask about such things, then it's a bit, we should be alarmed by that. We should be keen enough to pick that up and ask more questions, so as to know that, there's no harm that has happened to them, or they're not actually considering on doing anything harmful. Thank you so much for listening. I thought I should address this topic this way, and encourage fellow medics. I understand that we are exhausted most of the time, seeing different patients, doing this and that, but all in all, this world will not be better with a lot of suicidal cases, or with patients being unsatisfied with us. Yeah, we should still keep or maintain the trust the patients have on us, and at least attend to them and attend to them nicely, and at least attain a satisfaction. I'm sure that, and I totally understand that there are patients who are difficult and all that, but basic things we should just do them, and at least go an extra mile and allocate our time, our ears, to hear them out. We might be able to pick up something that if we were not keen enough, we would have missed it. Thank you so much. Kindly subscribe and continue sharing. Thank you.